Several nurses and doctors, some of whom work here at Beaumont Health, say it's a race against the clock getting people vaccinated. But in the meantime, once again, they're finding that this pandemic is taking a toll on them mentally and emotionally. And once again, they find themselves looking for light at the end of the tunnel.
We're bursting at the seams. We're overwhelmed with patients. Our ER is holding patients every day.
Every day, a grim reality inside local hospitals as COVID-19 cases continue to rise, keeping Michigan a hotspot in the nation. The highest number of patients hospitals report seeing since March and April of 2020, taking a toll on staff.
Well, it's not just the ER, it's the entire hospital. It is hard in the emergency department, and the challenge is the volumes that we're seeing. And so people are coming into the hospital. They may be staying a little bit shorter period of time, but we're having large numbers of patients that are cycling through the hospital.
The state's COVID-19 tracking site for cases, ICU, and bed capacity shows some units are 80 to 90% occupied. Kim Stasik, an ICU nurse at Beaumont Health, says it can be a heavy burden being the only connection patients have with their families.
We're seeing a lot of younger patients, average 40 to 60 for the most part. And a good portion of them have no other medical history. We're not seeing, like we did with the first surge, you had underlying conditions with diabetes or heart disease. A lot of these patients have nothing else in their history except for COVID.
Stasik says 13 months later, she feels we don't know anything about COVID-19 that's reliable, while also acknowledging there's a vaccine and a treatment plan for patients once they get to the ICU, met by staff who are already worn out.
I worked an 8-hour night shift on Monday night and walked in. Unfortunately, we were challenged with staffing. People are tired, so they're not picking up as much overtime as they did in the first and second surge.
Now, Dr. Justin Skrinsky here at Beaumont pointed out that they are generally not seeing people ages 65 plus. He says that is a sign that the vaccines are working. Reporting live from Royal Oak this morning, Darren Cunningham, 7 Action News.
All right.